Hey, deserving listeners, we have a really special guest on the podcast, an old friend of mine, a therapist here in Seattle. Why don't you introduce yourself to podcast land?
Hello, everyone. My name is Ewa Lichnowska, and I'm a psychotherapist and a sex therapist in private practice here in Seattle downtown.
Yeah. And if people want to find you online, spelling your name is E-W-A. So Ewa, E-W-A.
Yes.
And then in like American, it looks like Lichnowska, right?
Yes. So, yeah, on my Facebook, I have it written down phonetically, but I usually write it E-H-V-U-H.
Yeah.
And that helps people.
Yeah. Ewa. And how do you pronounce
Ewa
it?
Lichnowska.
Okay. And it's Polish.
Polish, yeah.
So you and I go way back. We were colleagues back in the day, like 25 years ago or something. We both worked for an agency in the area that would hire private practice therapists to go into the home.
Yes.
And podcast listeners that have been around a while might remember me talking about doing some of that in-home family therapy work, and you were doing it too. And we would talk shop and share stories and share clients, I think maybe at times, I'm not sure.
Right.
And that was it was an interesting gig. And then
that's how I got to know Seattle really well.
Okay, yeah.
Fresh off the boat, because I would have to ride everywhere, and I got to know the city and surrounding areas fast.
Right.
And also learned about people's like homes and, what real America is like.
Interesting.
Yeah.
You and I both slowly transitioned into full-time private practice, and then you hired me as a consultant.
Right.
So
for the agency, I think you were still my kind of supervisor pre-licensure.
Oh, I was?
Yes.
Oh, I forgot that.
At times.
Okay.
And then, yes, when I switched to private practice for years, until you stop doing that.
We would meet.
Consultant.
Was it every other week or something?
For years.
For many years.
Yes.
Yeah, maybe 10 years or something. It was a long time. And we would talk about your cases and about development as a therapist, all the really important things. Conversations could get deep and personal, and countertransferency and relational trauma, and personal ups and downs, and, and also just the style of therapy. And I remember feeling like we saw therapy very similarly in terms of the curative power of the relational process in therapy, the interpersonal, the intersubjective. I remember you and I would talk a lot about that, and how to have a corrective experience in therapy was something that should be very much paid attention to and really fostered. And that way of thinking isn't very common in the
and
field.
Yet, and this was something I learned from you a lot when I really embraced it, because it was always kind of in alignment with who I am and how I am, but it took a while to kind of integrate all of that, which makes me a different therapist, like you said. But it was really very, very important. I remember I got a lot more effective and develop higher capacity. I was a lot less tired,
Really?
A lot less drained.
Why do you think that is?
I think it's just because, like in relationships, when there is nothing hidden, there is nothing to wonder about, things are transparent, I think connections and security just increase.
Yeah. It gives us...
So, I never want my clients to wonder, what is she thinking? Is she judging me? Well, if there is something I'm thinking, I'm going to just say it.
Yeah.
Or if they want to know something, they can ask me. And I know myself enough to know that if I answer, I'm comfortable answering. If I'm not, then I will say that. So there's no wrong questions,
So as a sex therapist, you reached out to me and you wanted to talk about a number of different sex things, right?
Yeah.
And the first thing that we plan on talking about was how to close the orgasm gap. But first, let's take a break. What do you say?
Of course.
So during the break, you wanted to share something.
So we started talking about how, we know each other forever, and how I was first consulting with you. until you stop consulting. And it was difficult because, of course, it's a relationship and it's kind of similar to terminating graduating therapy. There is a lot of attachment going on.
Yeah.
But also at the same time, I felt, we got to know each other so well that, and this is also something that's true for clients, when they start to answer my questions before I ask them or talk themselves through stuff that I would normally talk them through, I know they're ready to go. And I feel we've reached the same kind of level. So at that point, it was like, what do I do now? And it was about the time when the pandemic hit. And I was both looking for someone new to consult, but also I knew for a long time that I wanted to train to be a sex therapist and specialize in it, because I already had worked with those types of issues, sort of self-taught for many years. And so then the opportunity kind of emerged to sign up and join the sex therapy program. And it was a little cheaper because we could do it kind of online without having to travel and all of that. So I jumped in, and that was great because... And another thing, just really briefly about the training, that it just being a seasoned clinician already and take the training in sex therapy was really helpful, because I could imagine that if it was myself earlier on, I might have been a lot more timid, a lot more agreeable, or hesitant to share some other thoughts that may not go along with the majority in the room or whatnot.
Well, you might have known more about the therapy process than the professors did at times, right?
I don't know. I mean, most of them also, were therapists and stuff, but I felt it was very beneficial.
Okay. What attracted you to becoming specialized in sex therapy?
So it kind of started with me taking some of those basic continuation education kind of courses credits. But the one that I took was with Barry McCarthy. And I don't know if your listeners are familiar, but he's an excellent sexologist. And I was really inspired. I was really inspired in his approach. And then, I started reading his books.
What inspired you about it exactly?
It was very down to earth, kind of like I am, not gimmicky, really rooted in kind of understanding what's natural and just kind of not getting in the way. And he shared kind of some, protocols, because it is true that to work with couples in sex therapy is a little different than in kind of typical couples therapy. So he kind of walked through that there is good incentive. It's good to meet with both parties individually at first, because otherwise we really don't get the full story. We kind of get a sanitized version. And if we don't know what the issues really are, what the private things in people's minds are, we can't really help them. But essentially, broadly speaking, what attracted me to it is this awareness that, well, first of all, once I became knowledgeable about sex and sexuality and comfortable with it, which is a process, everybody was talking to me about sex. So I realized how much need there is.
Everyone, meaning your clients?
Yes.
Yeah.
Mostly my clients, but even people outside, right? So it really made me realize that people really need this. That if there is things people don't talk to anybody about, there is pretty good chance this is something about sex, sexuality, or related.
Yeah. So you wanted to talk about how to close the orgasm gap. What is the orgasm gap and how do we close it?
Wow. It is true that, and just let me say, I talk about men and women and all of that, but just let's just say that this is not binary, and I kind of think of that as a spectrum or continuum, right? So whichever side of that your kind of listeners identify with, that's how I kind of encourage to think about it. So I might say it's statistically, male or female more this or that, right? These are numbers, these are statistics, but you can always have the reverse of it. But it is true, statistically speaking, that the orgasm gap does exist, particularly in heterosexual relationships, and that more often, if one party struggles with that, is the female, or, in that kind of relationship. And so, there is some research, but I also gave it kind of a lot of thought about why there is. And essentially, I think that what is the cause for the orgasm gap, kind of on the female side, is the same cause that's responsible for performance issue or performance issues or ED issues on the male side. Mm-hmm. And to put it simply, it's insufficient arousal. Why is it so? There's a couple of reasons. First of all, the anatomy. So, that male genitalia are kind of out there, and it's pretty obvious when the clothes come off or even on when there is arousal, right, in a penis. And it's pretty obvious. And another thing, because of that, when the, male genitalia are not fully ready, it's usually not compatible with performing sexual acts, right? So for females or, people who identify or with female anatomy, it's not as obvious. A lot of what's responsible for that is kind of inside, right? And there is poor knowledge of female anatomy. But we know that female have as much kind of erectile tissue as men, if not more. But it's kind of hidden and it's inside. So that's kind of one reason. Another reason that goes with insufficient arousal is what I call erection-centric pursuit of intercourse, right? So when the penis is ready, that's where a lot of times people proceed to intercourse, and a lot of times the female partner is not ready. And so that's not going to work out very well. Mm-hmm. So, these are the kind of basics as to kind of why that happens. I think there is kind of other reasons like social kind of norms around self-pleasure and kind of cultural and other messages, people receive. One thing that I would like all the girl and woman to know, that in my opinion, I want that to be the basic part of all sex education, which we know is lacking, right? There are certain things that people do know and people do learn, like, how to stay safe, contraception, and things like this, which most education is fear-based. But what I would like to know that I hope would help with that and change that is for every woman and girl to know that sex should feel good. Mm-hmm. It should feel good. And if it doesn't, because we are learning from experience, and usually it's not as great at first as we want it to be. But with that mindset, this is what, I would want to say to everyone. If it doesn't feel good, that means conversations need to happen with your partner about how to make it feel good. Mm-hmm. So these are the kind of, I think, to put it really simply, main reasons where that orgasm gap exists. And what we talk more about and what my clients a lot more often come with, particularly couples, is the desire gap. But I really believe the desire gap is just a symptom of the orgasm gap. Mm-hmm. Because when things feel good and they lead to satisfaction and climax, people tend to want to do them. Right. And more. Yeah. So another of my spiels or kind of mantras in my work, because a lot of times couple comes and say, well, how do I want to have sex more? And I'm like, well, we can talk about how to make your sex worth wanting, and then you're probably going to want it more.
Yeah.
But you can't, it's impossible to want it more or have a desire if this is not good enough, right? And it doesn't tickle that reward center in your brain.
Of course, there's a lot of paths to low libido compared to your partner. And what does that even mean? Because sometimes your partner wants to do it 3 times a day and the other person wants to do it 3 times a week. And the 3 times a week person is considered low libido. And you're just like, well, not on the average, But,
right, but in a different relationship, they would be considered, high libido,
right?
Or whatever.
They'd be considered to be
it's always
a
relative to
nymphomaniac
the
or something.
pattern, partner's libido.
Yeah, it reminds. I rewatched Annie Hall, and I know Woody Allen has some allegations that are pretty credible around his behavior with others, but I can't help it. I love that movie, and one of the funny, iconic scenes is both of them are in therapy. Woody Allen's character and what's her name? Well, Annie Hall. She's in therapy, and it's a side by side, editing, and Woody Allen's character is like, we never have sex. We have sex like 2 or 3 times a week. I mean, it's just like, I don't know. I don't understand what's wrong with our relationship. And then smash cut to Annie Hall, and she's like, oh my God, we have sex so often. It's crazy. We have sex like 2 or 3 times a week. I mean, my God, what's wrong? And,
It's always relative to the partner, right?
There's so many vectors, and one of them that you're highlighting is that people, when they chronically or their partner is complaining about lack of libido in the client that's coming to us, the client will say, how do I increase my libido? How do I increase my sexual vibe? And you ask them, well, do you enjoy having sex with your partner? And they'll say, well, he's better than my last partner or something. It's like, well, do you take pleasure? Do you want it? Does it attract you? It's like trying to get people to eat a dish that they hate. How do I make myself eat this disgusting dinner that I hate that my partner makes it's like, well, how about you change the goddamn meal,
Exactly. And so this is sometimes a hard sell because it's a lot more convenient for the higher desire partner to say, you're frigid or you're something's,
Right.
And sometimes...
Right. So that was what I was going to say, is that women are pathologized, right? That there's something insufficient about them, and then the woman has been told this her whole life that she has to perform in that way, and at no point she might have been told that, hey, get your hands on the reins yourself. What about your wants? What about what makes you feel pleasure?
It's the some kind of male sexuality centric in a way that the side, sadly, that's often pathologized is if it's less than the partner, then, they're frigid. Or if it's more, well, then women will get diagnosed, even though it's not a legitimate diagnosis and stuff, with sex addiction or sexual compulsivity, for wanting sex not nearly as often as a lot of men, right? And, men would never be even questioned, right? So sometimes it's like when men get what they want, that's also can trigger sometimes their insecurities, right? Because, when women fully discover themselves and discover themselves sexually, sometimes, or a lot of times, it may be hard for their partners to keep up with them. Mm-hmm. And then it's a different problem. So what I encourage people to kind of think about it, change just the mindset about it. And rather than thinking, in terms of faults or deficits, whose fault it is, whose issue it is, well, how do we make it work? So like you said, I think your example is pretty good, that if she doesn't want to, and I'm not saying this is the only reason, this is one of the reasons, then think about, well, maybe I should ask what could make it more attractive or more appealing, or or more exciting.
Right.
So,
And if you've never been in that position or that mindset, it is a paradigm shift, and it's not something that you can just walk away from one therapy session and say, okay, I'm going to take control of my sexuality, particularly if people have been traumatized. If I just think off the top of my head, the things that I've explored and collaboratively established as a conceptualization as to why there would be libido gaps or orgasm gaps. It's these things. It's also, of course, sexual trauma. It's also medications that people are on. It could be, hormonal pills as well. It could be something functional. It could be a lot of things.
And one thing that's very true, that's more biological, is that women have more cyclicity to their desire.
Okay.
Until menopause, of course, and so on. So what is a common disappointment or a complaint that in kind of early stages of relationships, a lot of women appear to have a lot higher libido that is their baseline, which is not true for men or, kind of male genitalia and all of that. So a lot of times after this kind of infatuation or kind of this first kind of fresh relationship energy passes, or when, couples move in together, that kind of returns to that cyclicity unless they have a super good reason not to. So that's some of that stuff that's hormonal and biological, that's very real, that a lot of times people were like, well, this is not what I was getting myself into. Like, I thought that the way she was kind of at the beginning was going to be how she normally is. So sometimes it's a little bit of a basic kind of sex education that when things change, it's not like this is bad, this is just normal.
Yeah.
And we need to adjust our expectations a little bit.
Yeah. And I've seen this in gay relationships too, for all genders, is that there's always a libido gap, is what I have found.
Right.
And any difference is going to be accentuated and potentially widened by the conflict, right? Because if someone is pursuing in a way that is invasive or accusatory or unwanted or something critical, the more libido person is like, trying to get things going, and the less libido person is just like, I don't know if I'm really into it. And the more libido person gets upset. Well, now the next time you engage, there's going to be worry.
Exactly.
And there's going to be tension for both people.
And a lot of times people try to accommodate and give in to that pressure, and whenever they give in to the pressure, or have sex to just placate the partner or to avoid some pushing or whatever, they give into it kind of out of guilt or something, they're almost guaranteeing that it's gonna decrease their want for sex.
Yeah, it's a chore.
Right.
It's potential for resentment and associating sexuality with a chore, with negativity, even traumatization of being exploited or coerced or something.
Yeah, in extreme cases, absolutely.
Yeah, or passive aggressiveness. I recall a client many years ago where they were in a situation and the low libido person would verbally say, yeah, let's do it, but physically was trying to punish their partner by not doing what would facilitate sexuality between the two of them. I'm trying to dance around the facts, but there's those potential reasons, and also just having young kids or stress at work or depression, anxiety will throw a wrench. And, often our society, and even among experts, I will hear that this is often genderized, that I remember this was a while back. Maybe this book no longer is being pushed forward at Barnes & Noble, the bookstore, but I just went to the sexuality section and grabbed a random book and was flipping through it. And it was one of the big books, and it was like it was a top seller in that category. And the whole thing was all about how men are this way and women are that way.
Yeah.
And with men, they are all accelerator. They're all gas pedal, and women are gas pedal and brake. And I'm just like, fuck you. Men have the exact same goddamn problems as women do. If they're not comfortable, then it throws a wrench.
Absolutely.
But it's seen as like, well, you're impotent, right?
Yeah.
Well, that's the same goddamn fucking thing.
So
they're uncomfortable.
Again, a lot of them, what I'm saying is that what is kind of invisible, right, with female bodies, and attribute, related to more orgasm or desire, for men, it more manifests in performance anxiety and anxiety-induced erectile dysfunction and stuff like this. And yes, it is true that I think what you're referring is the kind of dual control model of sexuality and the brakes and the accelerators. And yes, statistically speaking, men are more likely to have what it's called spontaneous desire. And so how would you describe that kind of desire precedes arousal? It's very closely kind of related to it. And then there's pursuit of gratification. Whereas for a lot of women, they are responsive in their desire, which means things need to get going.
Right.
They need to be stimulated.
They start from zero,
Right.
and the couple or the individuals have to tend to ramping up the engine, whereas the higher libido person or the more spontaneous libido person enters into the equation already out of 5 out of 10.
Right.
Or
and
10
so
out of 10.
what happens here is that spontaneous desire, which is, again, more male desire, statistically speaking, has been generalized to the model for desire, right? So if it's spontaneous, it's not desire, but it is, right? And the other thing is that spontaneous desire we talk about, which is I can have sex anytime with anyone on demand. It's only true for men of certain age, which is usually very young, when they don't need foreplay, right? And if you really buy into that model and that stereotype, welcome erectile issues when you turn 40 or something, right? So a lot of men that I work with, diagnose themselves with erectile dysfunction and stuff because they're not anymore like their 17 or 18 or selves.
Yeah, I've talked about this before. The erectile dysfunction label is fine, and it's the way we talk about it. But I have found, and I've talked to physicians about this as well, just to get a gauge for how medical folks talk about this. And it encompasses potentially hundreds of individual scenarios or conditions or mentalities. Someone that would normally expect to, and even the words that I have available to me, achieve erection, like that's such a weird word, right? We don't say that women achieve engorgement or wetness or readiness. They don't achieve that.
Conditions need to be met for them to occur.
Yeah, but it's so it's so capitalistic, right? It's so male. It's so competition or athletic or something.
Yes.
To achieve something. Someone achieved a goal and performance, right? And it's like performance. What performance? Like why are we using these goddamn words? Because that's how we see it. That's the way that it is framed. That's the way that we experience. It's the way we teach it to people inadvertently and advertently. There's so many different reasons as to why someone would expect or want a boner and they're not having it. That's why I use the phrase, and it's not the best, but I just use the phrase boner problem because it takes it away from the medical language. And or maybe a better term now that I'm thinking about it is just maybe a longer phrase would be like wanting a boner but not having one.
Right, and again, we have to.
Unwanted
sometimes
flaccidity.
There are medical causes that can be and are greatly helped with medication, and we are grateful for that. What I want to say, as far as what will help bridge and close that orgasm gap, the same things will help with the boner problem, right? Or whatever,
Unwanted flaccidity
Yes.
is the
Right.
phrase that I'm having.
Okay,
Because that's really what it is.
Right.
You're flaccid when you don't want to be flaccid. That's
Right.
it. It doesn't have to be some DSM label or something.
Right.
It's
And
just,
to me, it usually first signals either insufficient arousal or
discomfort,
or stress,
or
anxiety, and those we know interfere with arousal and responsive.
or not even wanting to have sex to begin with.
Absolutely.
Which is unheard of to consider that men aren't just walking libidos or walking boners, It's
Well,
just
they're
like,
not machines.
well, they're
not
human
sex
beings.
machines.
They're the same-
Exactly.
women and men, everyone's
And
a
this is
human.
another stereotype that I think hurts both sides.
Absolutely. Yeah. I can't tell you how many young men I've talked with about unwanted flaccidity. I'll have 18-year-olds that'll come to me. And this isn't just something that's, for older people. Physically speaking, it's more likely to happen the older you get, just because of blood flow and tightness of certain muscles that have to work in concert to have wanted non-flaccidity. But anyway, let's take a break. And during the break, I'm going to open the door because I've never had my little dog whine so much. She really wants to hang out
I'll
with
be
you.
happy to have her at my feet.
So I'm
seriously.
gonna open the door, and we'll be back from the break in a second. All right, we're back from the break. I'm going to make a note to call this episode Orgasm Gap and Unwanted Flaccidity. I spelled flaccidity, facidity, so flaccidity. My dog is now licking your hands, and
My pleasure.
all is good in the world.
Yeah, and by the way, my website and my business is pleasurematterstherapy.com.
Okay.
Because again, pleasure matters, and pleasure is a pathway to address both of these issues.
Right.
Following the pleasure.
Right. Another angle to sex therapy work is not just addressing pathology or discomfort or trauma, which of course it can, but it could be also considered a self-actualization exercise of couples or people who are, their sexuality might be going relatively okay, but they want to go down other roads, or they want to explore areas that maybe they don't even know exist, right? So it's that kind of thing. So another thing that you wanted to talk about that we had talked about prior was you want to talk about compassionate approaches to male sexuality.
Yes, so this is very related, but I feel like to wrap the first segment, I want to just talk a little bit more about what we can do about it, like how we can help follow that pleasure and reduce that gap. Because again, I think these solutions apply to both sides here. Is that okay?
Yeah, please.
Just really briefly. So, the first thing, this is actually kind of something I was inspired and adopted, but with my own kind of twist from Barry McCarthy, who often talks about 5 gears of touch. And so we talk about insufficient arousal as being the culprit. And I think it's important for everyone to learn the progression of their own arousal, because again, I'm going to speaking in terms of like manual gear shifter, manual transmission with 5 gears. The basic principle is that we never skip gears, right? So
You go from first to fifth.
Exactly. And a lot of times, right, one partner is at 4, another partner is barely at 2, and they get to the main act, right? Well, that's not how it works in manual transmission, right? It's usually like you have a destination, you want to go somewhere, and you start, and then you kind of develop some pace and speed up, and then there is stoplight, and then you start over from 1 to 2, and then you maybe get to 3rd or 4th gear, and then there is a turn or whatever, and you have to slow down and downshift until you get to the freeway, and finally you put on all these gears and you arrive at your destination. And so the way I name these gears, I think I find it helpful and helpful for my clients. So the first one is relaxation. Often very much neglected. And true, there are some people that sex for them is a way to reduce and kind of discharge stress. So they use sex as kind of relaxant or tension reducer. But a lot of people, particularly older people, and again, statistically more female, they need to clear their heads, they need to clear their to-do lists, they need to relax. So this is about kind of getting from this mind activity to somatic. So turning on the somatosensory cortex, be more in our bodies, be more kind of sensual when we're going to be able to follow the pleasure once we are. So things like spooning, stroking, kind of broad rhythmical movements, tuning into the breath really calms the nervous system, turns on the somatosensory cortex. And that's not to be neglected. It takes some time. And then the first gear is what I call non-genital foreplay. So these are things like, kissing, kind of caressing, more pointed touch, more teasy, something that stands out from the background. And the purpose of this is to kind of get the erogenous zones and genitals kind of interested and stimulated so they want to be touched. So that's the kind of purpose of this non-genital foreplay.
Yeah, another element to this is that it would reduce the risk of diving into the genitals too quickly for one
exactly,
of the
because for most people, of course, there are some exceptions like always, but the more the genitals and erogenous zones are erect, filled with blood, the more it feels good when they are stimulated and touched, and the more arousal, the more intense and rhythmical stimulation feels good. So what's going to feel good at gear 4 may be actually very unpleasant at gear 2.
I think that I'm thinking of a number of couples that I've worked with and individuals that there's a lot of different avenues to this, but I think the principle that I operate from is that we don't want to head to this phase, the genital, for most, and some people it's completely different. So many different variations of this, but there's a common theme for a lot of people that you don't want to dive into the genitals really quickly and put pressure on the person who is still catching up libido-wise in the moment to feel like, oh, okay, I guess we're heading to there when I'm not really ready. So what do I do? Because if the couple has really excellent open communication and a routine around that, then the lower libido person in the moment can just say, oh, I'm not really ready for that yet. Right. And the other person could be like, okay, fine. And then you did. So it's not that you just can't do it. A lot of these principles are trying to account for a lack of comfort with communication, really.
Right. And for a lot of couples who have it down, right, it's very intuitive because they've kind of already learned that. And they know they're not pursue it earlier because they know my partner is here and they're not ready yet.
Right. They know the signals.
But others have to just develop that language, and that's so I kind of try to help people with understand.
I think understanding the foundation and then maybe saying, well, until the two of you or until you as an individual with your partners have a very robust, open comfort with communication, whether verbal or nonverbal, then here's a little tip. Maybe just take a little time away from the genitals at first just to make sure that there's readiness along those lines and not pressure.
Exactly. And I think this is another when this benefit of this non-skipping gears makes sense, because it's for most couples in most engagement, it's not like they go to 1, to 2, to 3, to 4, to 5, which is climax, right? There's going to be situations when, there is full erection and it kind of wanes, and then we can get it back. But for a lot of times, we're going to talk about it probably in the next segment, it's like the erection is gone, it's gone. Well, it doesn't have to be this way, right? So if you're doing something and your body is not responding to your partner's efforts, or they're not responding, usually the signal is to downshift. But most people do the other. They pursue more aggressively, harder and faster. And my general thing is downshift first, right? So we have the gear 2, which is kind of non-genital foreplay that proceeds to genital foreplay, which is, again, when we engage first, maybe not exactly directly, but closer to these areas, kind of stimulating them, teasing them, but it's a little bit touch and go. It's less rhythmical. It's more gentle until there is a signal, I want more, like I'm ready, I want more, right? And then we proceed to what I call genital play, which is when you're engaged more directly in more rhythmical and progressive way, which can be, oral, manual, it can be intercourse, but we really don't attempt that until the subjective arousal is around, 7, 8, and then the genital play happens in that territory of like 8 and 9, and kind of going to the edge and coming back, and going to the edge and coming back, and then the climax is this 5. It's the ultimate,
The fifth gear.
The fifth gear, the fireworks or whatnot. But the more you can kind of shift between the 3 and 4 and 3 and 4 and 2, the more gratifying, satisfying, more likely simultaneous climax the couples are likely to have. Mm-hmm. So I really try to assist people that I work with to develop the understanding of their own body and what that progression looks like, and their partner's body, and what works to get them there, mm-hmm. right?
Yeah.
And so, other things that I think also help. And another thing about the gear 1, 2, and 3 is that a lot of men don't consider them to be sex, right? They think about foreplay is for my partner. But particularly later in life, when erections are not as automatic, not as taken for granted, the same thing that will work and will help, get those erections going, right? Mm. So men will need more of that foreplay. And so people complain about what happens with aging and stuff, but I see opportunity in everything. And when people really embrace these concepts and work with them, actually people are more satisfied. Because a lot of times when those erections are automatic and so fast, it's fun because they get off, but their partners maybe not so much, right? But when they work together and they progress together, then they're more likely to come together and then, enjoy that fulfillment, that gratification together.
Yeah. So why did you want to talk about compassionate approaches to male sexuality?
Well, many reasons, but I think the main reason is, I don't know why that is, but there was a time in my practice for a long time that probably like 90% of my clients were male. Now it's a little bit less so because I work more with couples and so on. But I think that really gave me its honor, right? To hear things from their perspective that are not maybe consistent with the stereotypical male sexuality, right? Because in some ways the toxic male sexuality became synonymous with male sexuality.
Yeah.
So hearing from a lot of guys about that, both in the context of sexuality and sexual performance, and what insecurities or anxieties so many experience, but they don't talk about.
Yeah.
And also, working with younger people in the dating world, in a modern dating world, in the kind of world after kind of Me Too movement, when there is when things are more complicated in a lot of ways, when there is no rules, no script on how to do it. it pushes, it kind of increases the bar for, it makes us need better, higher, more sophisticated communication skills to get us where we need to get. Before, when there was like a script, we could get away without that on the script. But the script doesn't really apply anymore, and people need to reinvent themselves. And I think both genders and, struggle with how to kind of adapt to that.
Yeah, a specific example that I can think of related to what you're talking about is that, and this wasn't the case with everyone, of course, and there's nuances, but in the past, I can only speak to Seattle culture, really, that it was within the gender roles traditional to some extent, maybe less traditional than other parts of the country or the world, but still, basically traditional in that the norm was heterosexuality, and within heterosexuality, men approach women, and there's a certain way that you do that depending on the situation or your personality or what is being signaled by the woman, and the woman is supposed to respond in a way that, if she's into it, that is not slutty, but also not cold, right?
Or not overly enthusiastic,
right.
The old script kind of.
Yeah. And and so once we we go through Me Too, and this is an oversimplification, but we started to reevaluate all those things for a lot of really important, good, healthy reasons. And you had a lot of, and this really started, in my observation, in the 90s. Not so much for my generation of Gen Xers, but the younger Gen Xers that were in high school in the 90s, they had a lot of trainings about sexual harassment and that kind of thing. And they, while they were trying to figure out sexuality and relationships and how to begin relationships and all that kind of stuff, they were being inundated. The men that I know, the clients and otherwise, were just being inundated with all these messages about consent and all that stuff, which is of course important, but it was oversimplified and it was ham-fisted. There were all those things that maybe people don't remember this, but I do, about how there was this mandate in college campuses that you would literally sign a contract before you had physical contact. I mean, that wasn't the official policy of universities, but that was essential, because it's like, well, how do you know for sure if someone is consenting? What if they're intoxicated off alcohol? Because that's, of course, a no-go. But you don't know that they're intoxicated.
Right. Or what's the level, right? Because, again, most times, for better or worse, I think it depends.
Yeah.
A lot of times alcohol is involved on a date or whatever, right?
Yeah.
So, yes.
For better or for worse, right?
Right.
And so you have these situations where young men are terrified of because they're not being given any kind of guidance other than what's being taught in these trainings or something.
So they were more told what not to do. And I also, run some workshops on affirmative consent and how to make it sexy.
Yeah.
Because a lot of times people have this association, well, it's going to spoil the mood.
Yeah.
Right? So I think there is a way to make it sexy. But I think you're touching on a very important point. So I think it's a very challenging landscape to navigate for any gender. But a lot of, and these are more likely the men I work with, because the other one who are more on sexual narcissism spectrum, of course, they're not seeking my services and stuff, right? So, but there is that kind of increasing awareness, and that's a great thing. But I think it does create certain challenges, and those great men who are going to be great prospective partners, like, they don't want to be that guy.
Right.
But what to do with this wonderful intention sometimes is very challenging, right? So what I see a lot of times is this kind of polarization. So on one end, there is this kind of stereotypical sexual narcissist who doesn't care, is concerned with their needs, and they don't want to ask certain questions because they don't want to get rejection. So it's always the kind of plausible deniability, right? So, that's all concept that no longer applies, was basically whoever is kind of in the more male role of pursuer, right, is supposed to conquer, and the other person is supposed to defend. So it's like, kind of brings a kind of association of sports when there is always kind of a loser and a winner.
Yeah, scoring.
And there is this fantastic video on YouTube about how we can change the dialogue about sex to be less like sports and more about like pizza. And it will go something like this. And I hope your listeners will quickly realize what I'm about to say here.
I have
How
no idea.
How do we talk about pizza? Well, are you hungry? I'm kind of hungry. Oh, yeah, I am hungry. Well, would you like pizza? Sure. What toppings would you like to get? Shall we agree on this one, or shall we maybe have this or have that?
Yeah.
And then the pizza arrives, and they have pizza, and then some, I'm kind of full.
Yeah.
Do you want more? Are you done? Yeah, might have some more, or maybe let's do some more later, right? I think that's a way to talk about sex.
Yeah.
Are you interested? Are you in the mood? If not, how can I get you in the mood? And then we kind of do the same thing.
Yeah, I like that.
Right?
Yeah.
So going back to where I left off, so on one hand, there is that kind of sexual narcissism that people are more aware of. They don't want, I don't want to be that guy. But a lot of times they kind of flip to the opposite extreme, right? Because I don't want to be intrusive, and you shouldn't. I don't want to make her uncomfortable. Then I'm making no moves, and I'm just waiting for her to do all the moves. And women also have to adapt to that, because a lot of them is like, well, if you're not making any moves, you're not interested, and bye. And there is a date that's awkward when both parties are interested. They're just waiting for the other person to make the first move, and nobody makes the first move. Women like to be found attractive, wanted, desired, and they like to have autonomy and authority, and they want that to matter, right? And we don't have to do either or. Either do this aggressive pursuit to detriment of her autonomy, or protect her autonomy and be completely passive.
Right. I really want pizza tonight.
Do
you want pizza tonight?
Exactly. and so this is it's pretty simple.
I really
when
want
you
pizza
think
with
about
you tonight.
Exactly.
Yeah.
But I won't do anything if
Do you want pizza? I really hope you want
interested.
pizza tonight.
Right. But I'm not going to force it down your throat. You can be assured of that.
Yeah.
But I'm going to try to make this pizza attractive to you, right? But getting the toppings you want and
I'll make
making
it attractive
good.
to start the process of ordering the pizza.
Right, but essentially it's like, I'm interested.
Now I literally want pizza.
I find you attractive, and I don't want to do anything that you're not interested in doing. Because another thing that I'm hearing from men is when they just have somebody be intimate with them out of any other reason, really, than being into it, it's not really as gratifying and as fun, right? And sometimes it really activates the insecurities, right? Because if I even watched this presentation for parents recently about how to talk to kids about porn and stuff, and this woman gave this example of how porn can really affect the gender roles and kind of make those gender roles more rigid in a way that, the male is dominant and she's more, receptive or passive. And then he's doing it for the first time. He doesn't know what he's doing. He doesn't know how to, but he's going to fake it because that's what he's supposed to do. And what is she supposed to do? Well, she's going to pretend to have the time of her life and be really into it. And who's having a good time doing this way? Nobody, right? So, being more vulnerable can be also attractive, can be sexy. And so like I'm into you and I want to figure out with you and with your help or by trial and error what sticks and what feels good, So that's that kind of commitment to mutual pleasure and satisfying mutual needs. Mm-hmm. So essentially the formula is, I'm thinking I am into da-da-da, are you? And if not, is there a way for me to make it work for you or make it appealing or attractive?
Yeah, and the ongoing communication, right?
Absolutely.
If you're having that conversation for the first time, things go a lot of different ways, but
so how do you like your slice, right?
Yeah, like with my wife, I don't need to start from scratch regarding what sort of pizza or when, or thin crust or thick crust, or that sort of thing. So having an ongoing comfort and foundation of understanding each other and understanding yourself too. You got to come to the table with your own knowledge of you.
Absolutely. What you arrived at with your wife, I'm guessing, unless you're just super lucky, it's because you probably talked and learned each other, and now you know what each other like to eat, right? Each other likes to eat. And so I think that when people have that kind of ongoing communication, then they do arrive at the place when it seems like they're reading their minds, but they're not. They just know.
Yeah. Yeah, that's why I was saying nonverbal, because a lot of the communication around sex and if the nonverbal isn't working, or if you're not sure, then you have to be explicit. But in my experience, personally and professionally, that 99% of what's being communicated and what's being received is done non-verbally. The moans literally that you have, or the direct of, like you take someone's hand and you move it this way, or you position your body in a certain way, or the way your body tenses up or something, or twitches, this sort of thing. These are all ways that we inadvertently communicate, but also we might sort of lean into that. To close out, you also wanted to talk, and you mentioned pornography. You mentioned when we talked earlier that you wanted to talk about myths and truths about porn. I guess I'm just realizing that you can say myth and the myths. The myths and myths. You know what I mean? The truths and truths. You know what I mean? There's a little difference there. So,
English is my second language, so if I ever get corrected, it's usually by my daughter. It's on my accents. So I don't know if I can help.
What are some myths about porn?
Well, I don't know if kind of speaking in terms of myths or truth or pros and cons, it's really all that helpful. I mean, that what came to mind, when I was kind of corresponding with you. But I think there is a lot of misconceptions. But let's be clear, it's out there. People are consuming it. Kids and youth are consuming it. And it's influencing, again, for better or worse, people's attitudes and people's sexuality. And so I think it's important that we acknowledge that, and that we don't stigmatize or demonize or shame or pathologize. So, one thing that is a little bit considered a myth, but of course I'm not saying that there is no examples or even widespread examples of problematic use of porn, right? Is the kind of sex addiction model that, any porn or any use of porn is bad, or is that gonna create progressive, out of control problem or addiction or harm. But of course, that can happen. I just don't think, and scientifically that seems to be supported, that addiction model is useful in terms of helping people who develop certain issues with that, or compulsive use.
Right. I mean, I don't know if this is what you're getting at, but there's a knee-jerk reaction among clinicians included, but particularly in society, that if there's any kind of pornography use beyond what people consider to be quote-unquote normal, and or if there's any kind of sexual problem in a relationship or with an individual, and that individual also consumes pornography and masturbates, it's this knee-jerk reaction to label it as a pornography addiction.
Right.
And I have actually treated people with pornography addiction, like legit pornography addiction, masturbation addiction, and there's a lot of overlap between those two, of course, but it's exactly the same as any other compulsive problem.
Well,
Like I had this one woman who was compulsively looking at pornography at work, even though she knew that the IT department was monitoring her because she had been caught before, and she was reprimanded and mandated to go to therapy with me because of this issue. That's an addiction. That's not just a casual consumption. It was this itch that she had in relation to potentially a genetic disposition for addiction, but also just like the common traumas and the common cycles of addiction that are common, whether it's gambling or cocaine or whatever.
Yeah.
So there is a thing called pornography addiction.
What you're touching on is actually an interesting thing that, like, just like with alcohol, a lot of people are exposed to it. Only a certain group or population will develop an addiction, right?
Yeah.
And it seems like there is a lot of overlap between OCD, obsessive compulsive disorder, and pornography or masturbation can just become the manifestation. So when somebody has OCD and they compulsively, out of control, wash their hands or check their stove or whatever, would you call it like hand cleaning addiction or something like this, right? A lot of times it just misses the core of the problem, right? Sometimes it's a regulatory problem where in a dual control model there is brakes and accelerators. Some people have very high libido and high accelerators and poor brakes, right? So they are more prone to out of control compulsive or engaging in sexuality that can cause harm to the relationship or to them or other or be risky, right? Labeling them as sex addict usually doesn't grasp the essence of the problem.
No.
And a lot of times we need to help them develop self-regulatory impulse control skills and things like this.
Could be that, but it also could
yeah.
just be, I had another client, this is like 20 years ago, who came to me saying that he had a pornography addiction.
Yeah.
And when I asked him questions to assess the situation, this was early in my career, so I had yet to discover this phenomenon. And I was surprised to hear his frequency was something like he looked at porn once every couple months or something. And I was like, huh? What are you talking about? And it turned out that his religion and his wife was also very much against it. And it had been this ongoing issue between him and his wife. And God bless, people can have their preferences if they want to. That's a conversation you should have prior to getting
what's
deeper into
considered okay, what's infidelity or
right.
whatnot. Yeah.
And I, in my head anyway, did not frame it as a pornography addiction. I framed it as this couple is and then I explored also with him of, you understand that there's a lot of range here in terms of what is possible regarding having a fulfilling life, not only in relation to pornography and masturbation, but just in your relationship. So is there any flexibility around here? I'm not saying you should be flexible, but is there? And we explored this for a long time, and essentially he concluded with me that there was no flexibility. He didn't even want to explore that. So I went down this road eventually of essentially treating him like he had a compulsive problem when he actually didn't, but he was really trying to work. So there's a lot of there's just this really knee-jerk, I think 30 years ago, we would have just labeled these people perverts or something. But in our addiction-oriented society today, we label them as sex addicts or porn addicts.
Yeah.
Because it's complicated and we don't want to look at what's actually going on underneath the hood, which
I like to do, by the way.
Yeah, which all of us as therapists hopefully like to do.
You've touched on something super important that's very well documented in research, that the degree of harm or subjective harm that somebody experiences as a result of their porn use or masturbation, other things, it's usually more related to kind of how they feel about it, their values, and whether it's congruent or incongruent with their values, than porn itself, right? So there are people, who do it multiple times a week or even many times a day, who have it doesn't affect their lives in a negative way.
Yeah.
It can actually be sometimes helpful in certain cases that I can talk about. And there are people who do it very, very rarely, but it's considered, a sin. It's considered a betrayal. It's considered sick. So it's the shame, and whether the shame is activated as a result of whatever the environment, the values, the partner's stance, the community stance, whether the shame occurs, because when shame occurs, and that's true, in some cases with alcohol, like a lot of people, when they start drinking too much, they'll self-correct, and some don't. And people with some history or family history, when they go to shame as a result of that, that's going to be hard for them to self-correct. It may actually escalate the problem, right? Because then you're using that activity, whether it's porn or alcohol, to cope with shame. And that's what creates this kind of compulsive loop a lot of times.
Right.
So, but again, there are certain situations where, with the right communication, understanding, and of course, what sources people use can be also very important, right? Whether it's, something that's produced ethically in a consensual manner, or whether it's exploitative, that's also often matters and should matter. But there are situations when in reality of, like we talked earlier, desire discrepancy in the couple, right? As long as, when my wife is into it and ready, I'm gonna go to my wife first. But when she's unavailable, because no matter how good it is, she doesn't want that more than twice a week, then masturbation can be, and porn use can be a little bit of that outlet that actually balances it out. Mm-hmm. But there are also certain cases, and I have clients like this, who started to compartmentalize it, and their kind of autosexuality became simultaneous with porn use, and it's easier, and it's more reliable, and there is less opportunity to trigger some of these anxieties or failure, and suddenly starts to really compete and interfere with couple sexuality. And of course, why wouldn't be blame the partner who feels like this is a competition? This takes away. Right.
And it depends, and every situation is different, but I'm glad you're bringing this up, because this is a very common conundrum or exploration or assumption, and I think it is a viable paradigm to have in some situations like this, where you have diminishing intimacy and physical connection but in a couple, and one of the individuals is looking at a lot of porn and masturbating, and let's just, in this scenario, let's say both people are totally cool with it. Maybe they both look at porn and masturbate, but one is doing it much more often as a part of the routine, and there's this question and assumption often of, well, you're ruining the couple sexuality because you're relying too much on pornography. And there's also, we should mention that there's this whole pseudoscientific assumption online, particularly among men, around like dopamine and around
how it rewires the brain and all that.
Yeah, like and there's just zero science, or extremely limited, dubious science that, maybe in 100 years we'll have some discoveries or some knowledge around this, but looking at very shoddy science with fMRI, and also just infusing culture, because, people grow up with the culture of shame and also of pornography. There's a toxic, it's weird as a man myself to really examine the toxic masculine messages, one of which is you're supposed to be constantly horny and you're supposed to do whatever you want to. And pornography and masturbation is kind of manly in a way, but it's also unmanly because real men don't need masturbation or porn. So it's like which direction? Anyway, so there's all this infusion, and they'll latch onto these pseudoscientific emerging sciences around and super reductive ideas about dopamine and other kinds of things. But anyway,
and I would say that everybody is entitled to have their opinions, to have their values. But I don't like when we just kind of thinly veil it under guise of science. Right. Yeah. So again, if you're against it, just say you're against it.
Right. So people, to finish my long-winded point is that what I eventually landed on with a lot of couples is that instead of looking at it as a issue to reduce, because often that's the thing. It's like, okay, you have to stop looking at porn and masturbating. The approach that I've found, generally speaking, that is easier to achieve positive outcomes is getting back to what you were saying much earlier, which is how do we make sexual intimacy between these two people, because they both want that actually. How do we make that more comfortable and attractive so that the individual who's looking at pornography and masturbating, they won't turn to that. When they get horny, they on average will have routines or will have efforts to connect with their partner and getting that routine back into their life. So because if you just take away the pornography, then it becomes a matter that seems like an addiction approach of just how do you deny yourself something? Absolutely.
Plus, we don't get to the root of the problem. So let me give you an example. We can say, well, you just can't masturbate because, we're not having couple intimacy or so on. What if, a lot of men, because of this talking about approach and compassionate approach, they don't think that they should need foreplay, right? A lot of men actually resistant to it. They want their partner be touched unless it's their penis, right? And they use their porn to get themselves erect and horny and ready, and then only they feel comfortable approaching their wife.
Right, because just a little chime in on this, of toxic masculinity taught us that to be interested in anything other than your penis being touched is actually to be a girl, to be a woman.
Or gay or something.
Exactly.
Right, yeah. And so, I've had a lot of men use it this way because they think that's, I have to already be up there and ready. What if, they are terrified of being touched when they're not already erect? What if I don't have an erection? And it's a little bit of a growth to be vulnerable and figure out. And this is true. A lot of times women feel like, well, if he's not already ready, am I not attractive?
Right. Because
they've never needed to do something to have their partners be ready. So that can be also stressful and vulnerable for women. But that can be learned. And sometimes it is really challenging and vulnerable. That's why some people need some mediator or sex therapist to help them with that.
Yeah,
right?
and
facilitate that kind of communication.
Yeah, and my hope would be that more people would avail themselves of services of someone like you. Along these lines, something that I have begun to prescribe to people, individuals and couples, is actually to have a planned unwanted flaccidity event, to just plan it, work it into your routine. Say, okay, today our therapist told us that we're supposed to get together and I'm supposed to purposely avoid getting turned on. Now, sometimes it's this, what commonly will be called reverse psychology or something, but we'll call paradoxical intervention or something, and it'll produce the opposite. But 9 times out of 10, if they actually do it, which they don't often, it will be helpful because it's just like, oh, it's not that bad. It's not the end of the fucking world that you have unwanted flaccidity. Right. What's the big deal? Okay, we finally got the kids to bed, and we have that one moment of the week to actually have sex, and we're going to purposely not have sex. Well, you got naked, you talked, you had eye contact, you touched each other, you got in bed,
Right.
you had a connection, you put your phone down. Well, all those things are good things.
So it's about how many gears you checked, right? Because we can have good time without going to 5.
Yeah.
So
Also,
I'm also saying, if you just end up at cuddling and you fall asleep, good time.
The other thing in regardless of sexual orientation, is the unwanted flaccidity individual. They're just one of the individuals. There's other people in the bed. So you can have an unwanted flaccid moment and the other person could have the time of their life. So just working that, just having that prescribed into it, it's just like, it's okay. Calm the fuck down. You had a flaccid moment. Like it's okay. And by having that, it frees people,
Absolutely. And we are so focused about, this is what I can't do. This is what I can't do. And it's like takes the center stage. And a lot of times with my clients before, well, what can you do? Start with what can you do? She says no to no to this, right? So, well, what can she say or I can say yes to? And how can we get to yes, right? So that's a kind of a lower pressure approach. And you also reminded me, this is actually some of the things that I remember from my first workshop with Barry McCarthy and one of his exercises, right? He said, make sure, this is part of his approach, to get the person with the penis to have it go flaccid 3 times during the engagement. Why? Because this teaches that, it can go down and the, lightning doesn't strike necessarily and moon doesn't fall from the sky. and when it gets limp or flaccid, well, it can get back up. So again, you were at 4 and then maybe you focused on your partner and you weren't stimulated for a while and it went limp. Well, downshift, get back to what got it up in the first place and do it a few times. And it teaches people that, okay, it's down, it can go back up. What does it help it go up? Let's do that, right?
Yeah.
Rather than, like I said earlier, the first moment the erection weakens or disappears, that's the end of an engagement, and everyone ends up with embarrassment, shame, puts their clothes on, never looks in the eyes, and it's like a scar, right? That's associated with sexuality. That's not going to make people anticipate that with joy and excitement, right?
Yeah.
That's not the great place to leave off.
Right. Yeah. So in conclusion, where can people find you online?
So yes, at pleasurematterstherapy.com.
And you provide services for people in Washington State because you're licensed in Washington?
Yes. I'm actually soon will be pursuing probably licensure in other states like Arizona that have kind of reciprocity or, we're still waiting for the reciprocity, with the compact and so on. But right now, I'm licensed in Washington State, provide services in person and online. But, people from other states can also reach out to me for a consultation or coaching session or something like this, or education session.
Great.
Or,
And by the way, for many years, I've had this Word doc of therapists that I will refer people to, and I'll just copy and paste their name and their email and their phone number and their specialties and their website instead of constantly having to remember all that stuff. Someone will say like, do you have any referrals, whether it's a friend or a colleague or whatever. And you've always been at the top of my list.
Oh,
because
thank you.
I know you to be a very good therapist and a deep therapist, a smart therapist, a hardworking therapist, a true therapist, someone who really will take the time and values the potential of what therapy can be, that it can be very intimate and can be very curative and can be very corrective. And you're also very humble. You're not one of those therapists that, thinks that you know everything or anything like that. You don't come across as superior or anything. Oh. You're what I think of as a true therapist, and I'm not joking. I've always had you like at the top of the list, and the list often only has like 2 or 3 people, even though I have, you know, dozens of people that I know. There's a very short list of people that I would even refer people to anyway, as evidenced by the fact that I've sent you many people that I know in my,
thank you.
Not only just, you know, and you've sent clients to me as well. I've sent people to you in my personal life, you know, like friends and family members and stuff. So, so I encourage everyone, if you're in Washington State in particular, or if you're looking for consultation outside, to go to pleasurematters.com.
Pleasure Matters Therapy.
Pleasurematterstherapy.com.
Yes.
And everyone out there, please take care of yourself. Why should people take care of themselves?
Because happy people are good to be around, and happy people have something to give. You can't give from empty.